Action. Hi, my name is Jonathan King. This is my, what is it? My preparation for RSI scenario video osce. So I've checked for safety. I think we're good to go. Here we go. So we've got a suspected head injury here. We're just going to go through the paces and call for RSI and prep for RSI. Thanks. So I'm going to go through. Oh,
Where do you want me?
this is my lovely assistant Joe. So we're going to determine, run through our primary survey, see if there's any abnormalities there. Joe, if you could just jump in and get some obs for us. Blood pressure. Determine what's going on, the mechanism of injury. Has the patient got an altered level of consciousness? Any abnormalities in that ABCs, and then we're going to rectify those. So that early call for an RSI paramedic, and we're going to determine that this guy's got a head injury and he needs to be somewhere other than here. So we've determined that this guy has come off his motorbike. He's got a significant head injury, and we're worried about his decline in his GCS. So we're going to monitor those ABCs, blood pressure. We're going to try and keep up with that 120 to keep that brain perfused. Keep in mind the map and saturations, working of breathing, and then we'll run through the checklist. Alright, so yeah, Joe, we'll pop this on. We'll give him some, if we get SPO2 on him.
Push.
Just tucked around the back there. Okay, typo 1 to control. And we're going to call for an RSI. So they're on their way. Joe, if we could get the prep for RSI checklists.
Yep, I have here.
Yep, and if we can get an IV in too, that would be great.
Sure.
And we'll hang up some fluids. Got a bag mask here. Does he tolerate an simple airway, OP airway?
I have one. Did you want two IVs?
Well, at the moment we're fine with that, but we'll just go through that checklist and work from there. Thank you.
So, RSI checklist. Attach nasal prongs without oxygen.
Okay. Nasal prongs, the ones that we've got set up through there, yes?
Yeah.
Yep.
Pre-oxygenate using a reservoir mask at 10 litres per minute, or a manual ventilation bag at 10 to 15 litres per minute with PEEP, set at a minimum of 5.
Okay. So he's got his own respiratory effort. We've got the reservoir mask on. We do have sorry, there we go. So we do have the reservoir mask on. Bag mask is at the ready with PEEP set to 5. Okay.
Attach ECG, NIBP and SPO2, which we've done.
Check.
Prepare capnography if this is available.
Alright. Prepped. Calibrated. Alright, that's calibrating.
Position the monitor so that it can be seen, leaving space to the right side of the patient's head for intubation equipment.
Yep. So we have space there, we have a towel to place our equipment.
Gain IV access, preferably in 2 sites.
Okay, do that. We're going to get another one here. Yep, thank you. I like it when we go like that.
Prepare a running line of sodium chloride.
Yep.
Done.
So we've got that line running.
Position the patient for optimal airway control. For example, consider placing a folded towel under the head.
Folded towel is under the head.
Place an ETT holder with the strap undone under the patient's.
prepared earlier. Okay,
Ensure suction is working and turn it off.
suction, yep. Suction coming. Suction. Oh. Pete.
Prepare prepare a manual ventilation bag with PEEP valve attached.
Pete. Set 2, 5. Check.
Obtain a set of vital signs.
Copy. So I'll run through that. Blood pressure, SpO2. Yep.
If possible, update the responding ICP with the patient's condition and vital signs.
Control from Taupo 1. Our patient is a declining GCS. Would like a, and we'll give them a set of blood pressure, SpO2, GCS, etc.
Prepare the area. If the patient is not in an ambulance, clear the area so that there is access to both sides of the patient if possible. If the patient is in an ambulance, clear away as much unnecessary equipment as possible and consider travelling toward backup.
Copy.
Check patient.
Alright, cool. So we're travelling towards our RSI medic. We have everything set to go, and we've cleared the decks.
Yep.
Yep. Alright, cool.
Done.
Great. Good luck, mate.